Drug used to treat asthma. There are two categories of anti-asthmatic drugs: bronchodilators and anti-inflammatory agents. Bronchodilators reverse the bronchospasm of the immediate phase, which is often called symptom relievers. Anti-inflammatory agents inhibit or prevent the inflammatory components of both phase, which are preventatives. The main drug used as bronchodilators are beta-2 adrenoreceptor agonists as a first-line drugs. Others include xanthine, leukotriene receptors antagonist, and muscarinic receptor antagonist. Example for beta-2 agonist is salbutamol. Theophylline is example for xanthine drugs. Ipratropium is a muscarinic antagonist, and lonteleucist is a leukotriene. The main drugs used for their anti-inflammatory is corticosteroid. Example, fluticasone. Regulating bronchial constriction and dilation. The slide depicts a simplified pathway explaining how bronchial smooth muscle tone is regulated. On the left side, we see factors contributing to bronchial constriction. Adenosine stimulates bronchial constriction, but this effect can be blocked by theophylline, a drug that acts as an adenosine receptor antagonist. Acetylcholine, released from parasympathetic nerves, also promotes constriction. However, this pathway can be inhibited by muscarinic antagonists, which block the action of acetylcholine on muscarinic receptors. On the right side, the pathway for bronchial dilation is shown. Beta-2 agonists, such as salbutamol, enhance the formation of cyclic AMP, which is a critical second messenger for smooth muscle relaxation. Theophylline also plays a role here by preventing the depletion of cyclic AMP. It inhibits the enzyme phosphodiesterase, which breaks down cyclic AMP, thereby sustaining its levels and promoting dilation. In summary, bronchial tone is a balance between these opposing mechanisms. Drugs like muscarinic antagonists, beta-2 agonists, and theophylline are important pharmacological tools to manage conditions like asthma and chronic obstructive pulmonary disease. Beta-2 agonist. Their primary effect in asthma is to dilate the bronchi by a direct action on the beta-2 adrenoceptors on the smooth muscles. They increase mucus clearance by an action on cilia. They also inhibits the chemical mediator release from mast cells and TNA-alpha release from monocytes. Beta agonists can be categorized as short-acting agent and long-acting agents. Short-acting agents, such as salbutamol and terbutaline, these are given by inhalation. Maximum effect occurs within 30 minutes and duration of action is 3 to 5 hours. Long-acting agents, such as salmeterol and formoterol, duration of action is 8 to 12 hours. Systemic absorption leads to unwanted side effects, which are tremor, tachycardia, and cardiac dysrhythmia. Methylxanthine drugs. They antagonize the adenosine receptor, which prevents the bronchial constriction, and inhibition of phosphodiesterase enzyme causes increased level of cyclic AMP, which leads to bronchodilation. It is used as anti-asthmatic agent, even though it works in central nervous system and cardiovascular system. Methylxanthine stimulates the central nervous system, and it increases the alertness. They can cause tremor and nervousness. It acts as respiratory stimulant. In the cardiovascular system, it stimulates the heart, having positive chronotropic and inotropic action, while relaxing vascular smooth muscle. They cause generalized vasodilation. Let's look about pharmacokinetics. Theophylline is well absorbed from the gastrointestinal tract. It is metabolized by the cytochrome P450 system in the liver, which is influenced by many unwanted drug interactions. Its plasma concentration is increasing by drugs that inhibit P450 enzyme, such as erythromycin, clarithromycin, ciprofloxacin, and fluconazole. Its plasma concentration is decreased by drugs that induce P450 enzyme, including rifampicin, phenobarbital, phenytoin, and carbamazepine. The main compound used in muscarinic receptor antagonist is ipratropium, which is long-acting drug used in maintenance treatment of COPD. Leukotriene's receptor antagonists are used in exercise-induced asthma and aspirin-induced asthma. It is less effective than the salbutamol. Montelukast and zafralukast are some of the examples. Now, let's look at the mechanism of action of glucocorticoids and how they reduce inflammation. Glucocorticoids block the enzyme phospholipase, which normally converts phospholipids into arachidonic acid. By inhibiting this step, the production of arachidonic acid is significantly reduced. Arachidonic acid is a precursor for inflammatory mediators such as prostaglandins and leukotrienes. These are synthesized via the cyclooxygenase pathway. By decreasing arachidonic acid availability, glucocorticoids indirectly reduce the release of these inflammatory mediators. Glucocorticoids also suppress the production of pro-inflammatory cytokines, which are essential signaling molecules in the immune response. Additionally, they inhibit IgE antibodies, which play a role in allergic reactions. Beclomethicin is better in regular usages. Budesonide is a potent drug, which is preferred to severe conditions. Oral prednisolone is prescribed for acute attack. Most common side effect of corticosteroids is oropharyngeal candidiasis as fungal infections. Combination inhalers are beneficial because they simplify treatment by reducing the need for multiple inhalers, improving patient adherence to therapy.